Dental assistants support dentists by performing hygiene and lab tasks for patient care. In a dental assistant interview, you can expect questions about your background, handling situations, and applying your skills and knowledge. So, in this video, we'll go through 16 of the most common dental assistant interview questions, each with a high converting sample answer you can use right now during your interview. Here's a bonus tip. Study the job description before your interview. This way, you can add specific qualification requirements to your answers to better match them with the expectations of the job role. Let's get started. Question number 1. Why did you choose dental assisting as a profession? Interviewers ask this question to understand your motivation and passion for the dental assisting profession. It helps them gauge your commitment, interest, and the factors influencing your career choice. Your response can reveal your dedication to patient care, interest in the dental field, and how well your personal goals align with the values and needs of the practice. I chose dental assisting because I've always been interested in healthcare and wanted a job where I could make a difference in people's lives. Dental health is important, and I love helping people maintain their smiles and oral health. I also enjoy working with my hands and doing detailed work, which is a big part of dental assisting. The job offers a good mix of patient interaction and technical tasks, keeping things interesting. Additionally, I wanted a career that offers stability and opportunities for growth, and dental assisting provides that. Seeing patients leave the office feeling better and more confident about their dental health is incredibly rewarding. It combines my passion for helping others with my interest in dental care, making it the perfect career choice. Question number 2. What training and certifications do you have as a dental assistant? Candidates should provide details of their educational background and the specific dental assistant programs they've completed. They should mention certifications like Certified Dental Assistant, CDA, or Registered Dental Assistant, RDA. The ideal candidates continuously seek to upgrade their knowledge and skills. I have completed my dental assistant training program from here you mention the name of school or the institution, where I learned about dental procedures, patient care, and office management. During my training, I gained hands-on experience taking x-rays, preparing patients for treatments, and assisting the dentist during procedures. I also earned my Dental Assisting National Board (DANB) certification, which required me to pass exams in infection control and radiography. I also have CPR certification, so I'm prepared for emergencies in the dental office. I keep my skills up to date by attending workshops and continuing education courses. This helps me stay current with the latest dental techniques and technology, ensuring I can provide the best care for our patients. Question number 3. Why do you want to work for us? Interviewers want to understand your knowledge of the company and see if your values align with theirs. To answer, mention specific aspects of the company that appeal to you, such as its mission, culture, or recent achievements. Highlight how your skills and goals align with the company's objectives, demonstrating your enthusiasm and fit for the role. I want to work for your company because I admire your commitment to providing high-quality service and your strong reputation in the industry. I have always been impressed by how you prioritize customer satisfaction and innovation. I believe my skills and values align well with your company's mission. I am particularly excited about the opportunity to work with a team of talented professionals who are passionate about what they do. I see a lot of potential for personal and professional growth here. Your company's culture of continuous learning and development is something I value highly, and I am eager to contribute to and grow within such a dynamic environment. Question number 4. Describe a typical day as a dental assistant. Candidates should detail a day of varied tasks, demonstrating their ability to handle diverse situations. They might mention preparing treatment rooms, assisting with dental procedures and surgeries, talking to patients, providing details, and coordinating care, record keeping, cleaning and sterilizing instruments and equipment. Skilled applicants will understand the clinic's needs and role in maintaining efficiency and providing a positive patient experience. A typical day as a dental assistant starts with preparing the treatment rooms for the day's patients. This means setting up the instruments and ensuring everything is clean and sterile. When patients arrive, I greet them and make sure they're comfortable. During the dental procedures, I assist the dentist by handing them the necessary tools and keeping the patient's mouth dry using suction devices. I also take and develop x-rays as needed. Throughout the day, I update patient records and ensure all equipment is in working order. I clean and sterilize the instruments between patients and prepare the room for the next appointment. Sometimes I also handle administrative tasks like scheduling appointments and answering phone calls. The goal is to ensure everything runs smoothly and patients have a positive experience. Question number 5. How do you manage the sterilization and disinfection of dental tools and equipment? Experienced dental assistants should explain protocols like autoclaving, chemical disinfectants, and maintaining sterile storage. They should also mention adherence to OSHA and CDC guidelines to prevent cross-contamination and infections. I manage the sterilization and disinfection of dental tools and equipment by following strict protocols to patient safety and prevent infections. First, I clean the instruments with water and detergent to remove debris. Then I place them in an ultrasonic cleaner to remove any remaining particles. Afterward, I rinse and dry the instruments before putting them in sterilization pouches. I label each pouch with the date and type of instruments inside. Finally, I use an autoclave machine to sterilize the tools at high temperatures. For equipment that can't go into the autoclave, I use approved disinfectants to clean all surfaces thoroughly. I also regularly check and maintain the sterilization equipment to ensure it works properly. This process ensures that all tools and equipment are safe for patient use. Now, before we continue, check out these awesome videos. I have posted the links to them in the description below. Also, don't forget to like and subscribe to my channel for more great videos posted every single week. Question number 6. What dental software and patient scheduling experience do you have? Candidates should mention dental practice software they've used, like Dentrix, EagleSoft, or Open Dental for scheduling, updating patient records, and managing billing. Candidates should also mention their willingness to learn new tools and processes, not just those familiar with your current software. I have experience using several dental software programs, including Dentrix and EagleSoft. These systems have been essential to my daily tasks in managing patient records, scheduling appointments, and handling billing. I am comfortable navigating these platforms to update patient information, schedule and confirm appointments, and ensure accurate billing and coding. In my previous role, I used Dentrix extensively for patient scheduling. I managed the calendar, booked appointments, sent reminders, and rescheduled as needed. I also handled cancellations and made sure the schedule was optimized for efficiency. With EagleSoft, I worked on patient scheduling and maintaining comprehensive patient records, ensuring all data was up to date and accurate. My experience with these software programs has allowed me to streamline office operations, improve patient satisfaction, and contribute to a more organized and efficient practice. Question number 7. Have you assisted with dental surgeries? If so, what types? Top candidates should detail their hands-on experience with procedures like extractions, implants, and periodontal surgeries. Hiring managers want to understand if they can explain preparing surgical sites, managing tools, and understanding pre- and post-operative care. Do they demonstrate the ability to calm anxious patients? Yes, I have assisted with various dental surgeries. I have experience with extractions, including both simple and complex ones, as well as root canals. During these procedures, I helped prepare the surgical area, sterilized instruments, and assisted the dentist by handing them tools and keeping the patient comfortable. I also monitored patients' vital signs and provided post-operative care instructions. Additionally, I have experience with placing dental implants and performing bone grafts. My role involved ensuring everything was ready for the surgery, assisting throughout the procedure, and helping with patient recovery and follow-up care. This hands-on experience has helped me become proficient in surgical protocols and patient management, making me confident in assisting with various dental surgeries. Question number 8. How do you handle dental emergencies? Candidates should be familiar with common dental emergencies such as severe toothaches, broken crowns, or chipped teeth. They should describe immediate actions, stay calm, reassure the patient, ensure safety, assess the situation, and collaborate with the dentist to resolve the issue. In a dental emergency, staying calm is my priority. I quickly assess the situation to understand the severity of the issue. If a patient is in pain or experiencing significant distress, I comfort and reassure them while informing the dentist immediately. I assist the dentist in prompt care for common emergencies like broken teeth or severe toothaches. This may include preparing the necessary instruments, taking x-rays, and ensuring the patient is as comfortable as possible. I also follow established protocols and safety procedures to manage the situation effectively. Communication is key, so I keep the patient informed about what is happening and what steps will be taken to address their problem. Overall, my goal is to ensure the patient receives quick and efficient care, reducing their discomfort and addressing the emergency in a professional manner. Question number 9. How do you ensure patient comfort with dental anxiety? Hiring managers are looking for applicants who detail their strategies for easing patient anxiety. Empathy is key, but candidates should explain calming techniques, have clear communication skills, and have knowledge of anesthetic options. They should be able to create a welcoming clinic environment and address patient concerns effectively. I understand many patients feel anxious about visiting the dentist, so I always aim to make them feel as comfortable as possible. First, I greet them with a warm smile and a friendly attitude to help them feel welcome. I then take the time to listen to their concerns and answer any questions they may have about the procedure. I explain each process step in simple terms so they know what to expect, which helps reduce fear of the unknown. I also encourage patients to let me know if they feel uncomfortable at any point so I can adjust and make them feel better. Sometimes I use calming techniques like deep breathing exercises or even play soft music in the background. I aim to create a safe, reassuring environment where patients feel cared for and less anxious. Question number 10. How would you handle a patient unhappy with their treatment? This question evaluates candidates' communication skills. Hiring managers observe if candidates listen actively, acknowledge the patient's concerns, and collaborate with the dentist to address the issue or clarify the treatment outcomes. High emotional intelligence and problem-solving skills are essential. Use a problem-solving test to assess applicants' ability to handle difficult situations. When a patient is unhappy with their treatment, it is important to handle the situation with empathy and professionalism. First, listen to their concerns without interrupting. Show that you understand by repeating back what they've said. I apologize if there was any misunderstanding or mistake. Next, ask them about their specific issues and desired outcomes. This will help you understand their expectations and find a solution. Explain clearly what steps can be taken to address their concerns. Ensure they agree on whether the solution involves changes or a new plan. Sometimes, involving a supervisor or another healthcare professional might be necessary to provide additional support. Always follow up with the patient to ensure their issues have been resolved and that they are satisfied with the new approach. This shows you care about their well-being and are committed to quality care. Question number 11. How do you handle sensitive patient information? Candidates must understand confidentiality and adhere to privacy laws like HIPAA. Look for practices such as securing physical and electronic records, sharing information only on a need-to-know basis, using secure methods for transmitting sensitive data. I handle sensitive patient information with the utmost care and respect. Firstly, I follow all privacy laws, like HIPAA, which means I never share patient information without proper authorization. I always store patient records in secure, password-protected systems and ensure that physical files are kept in locked cabinets. When discussing patient information, I do so only in private areas where unauthorized people cannot overhear. I am also careful not to leave patient records or computer screens unattended with sensitive information. If I am uncertain about handling specific information, I always consult with my supervisor to ensure I follow the correct procedures. By maintaining these practices, I help protect patients' privacy and build trust with them, which is crucial for providing quality care and maintaining the integrity of the practice. Question number 12. What would you do if you noticed a mistake in a dentist's treatment plan? The best responses will demonstrate a professional approach to sensitive situations. Candidates should explain that they would first gather all the necessary information and review the patient's records thoroughly. Then they would address the issue by speaking to the dentist privately to share their concerns. The response should emphasize ensuring the patient's safety, maintaining their trust, and protecting the dentist's reputation as key priorities. If I noticed a mistake in a dentist's treatment plan, I would handle it carefully and responsibly. First, I would double-check the information to make sure it's truly a mistake. I would politely and calmly bring it to the dentist's attention if I still believe it's incorrect. It's important to be respectful and not accuse them of making mistakes. I would say, I noticed this detail in the treatment plan and have some concerns. Could we review it together? This shows that I'm interested in understanding and solving the issue rather than placing blame. If the dentist agrees it's a mistake, we can correct it and proceed. If they don't, I might seek a second opinion from another dentist to ensure I get the right treatment. My main goal is to ensure my dental health is handled correctly. Question number 13. What would you do if a patient has an allergic reaction during a procedure? Top candidates will be well versed in emergency protocols. They should describe their immediate actions, such as halting the procedure, assessing the patient's condition, and notifying the dentist and other medical personnel if necessary. For severe reactions, they might administer first aid, such as using an EpiPen. The best applicants will also detail how they would analyze the situation afterward to determine if it could have been prevented. If a patient has an allergic reaction during a procedure, I would stay calm to manage the situation effectively. Immediately, I would inform the dentist and alert the rest of the medical team. My next step would be to follow the office's emergency protocol. This might include stopping the procedure and ensuring the patient is comfortable. If prescribed, I would check the patient's airway, breathing, and circulation and administer emergency medications like antihistamines or epinephrine. I would monitor the patient's vital signs and keep them calm and reassured until the reaction subsides or further help arrives. If necessary, I would assist in calling emergency services and provide detailed information about the patient's condition and the steps we've taken. Throughout the process, I would document the incident accurately and thoroughly for future reference and to help prevent similar situations. Question number 14. How do you manage your time effectively when working with multiple patients? Hiring managers ask about time management with multiple patients to assess your organizational skills, task prioritization, and efficiency in high-pressure environments. They want to ensure you can balance quality care with a busy workload. Using tools like schedules, checklists, or electronic health records shows you can maintain high standards while managing multiple responsibilities. Managing time effectively when working with multiple patients involves careful planning and organization. First, I prioritize tasks based on urgency and importance, ensuring that critical needs are met promptly. I use a schedule or a to-do list to keep track of appointments, treatments, and follow-ups. Communication is key, so I ensure clear and concise updates with patients and colleagues to avoid misunderstandings and delays. I also set realistic timeframes for each task and stick to them as closely as possible. Delegating responsibilities when appropriate allows me to focus on more complex tasks. Staying flexible is essential, as unexpected situations can arise. By remaining adaptable and calm, I can adjust my plan without compromising patient care. Taking short breaks to recharge helps maintain focus and efficiency throughout the day. By balancing planning, communication, and flexibility, I can manage my time effectively and provide the best care for my patients. Question number 15. Describe how you would handle working with a new dentist. Interviewers ask how you would handle working with a new dentist to gauge your adaptability and teamwork. Emphasize your flexibility, communication skills, and eagerness to collaborate. For example, I would approach working with a new dentist with an open mind and positive attitude. By actively listening and asking questions, I can quickly understand their preferences. I value teamwork and clear communication, which helps build a strong professional relationship and ensure smooth operations in the clinic. When working with a new dentist, I would first introduce myself and learn their preferences. I would ask about their work style, preferred tools, and any protocols they follow. It's important to communicate clearly and frequently to ensure we're on the same page. I would also familiarize myself with their office layout and procedures to assist effectively during treatments. Being attentive and responsive to their needs is key. I would always be ready to adapt and learn, showing flexibility and a willingness to help wherever needed. I believe building a good rapport is essential. I would be friendly, professional, and respectful, creating a positive and supportive working environment for both the dentist and the patients. And finally, question number 16. Do you have any questions for me or for us? As a dedicated dental assistant, I want to understand more about the practice's commitment to professional development. Could you elaborate on the training opportunities and continuing education programs available to staff? Additionally, I'm curious about the team dynamics within the office. How do you ensure effective communication and collaboration among team members? Could you also provide some insight into the typical career progression for a dental assistant within your practice? Understanding these aspects will help me gauge how I can best contribute to and grow with your team. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.